Urinary catheters. A urinary catheter is a hollow, partially flexible tube that collects urine from the bladder and leads to a drainage bed. Urinary catheters come in many sizes and types. They can be made of rubber, plastic, PVC, and silicone. Catheters may be necessary where urine is uncontrollable, have urinary incontinence, urinary retention. The reason why a patient may not be able to urinate on their own can include blocked urinary flow due to bladder or kidney stones, blood clots in the urine, severe enlargement of the prostate gland. Types of urinary catheters. There are three main types of catheters: indwelling catheters, external catheters, short-term catheters, which is shown in this picture. Indwelling catheters, also known as urethral or suprapubic catheters. Indwelling catheter is a catheter that sits in the bladder. This is also known as foley catheter. This type can be useful for short and long period of time. A nurse usually inserts an indwelling catheter into the bladder through the urethra. Sometimes they will instead insert the catheter into the bladder through a tiny hole in the abdomen. This type of indwelling catheter is known as a suprapubic catheter. A tiny balloon at the end of catheter is inflated with water to prevent the tube from sliding out of the body, as shown in this picture. The balloon can then deflate when the catheter needs to be removed. External catheter, also known as condom catheters. A condom catheter is a catheter placed outside the body. It's typically necessary for people with a penis who don't have urinary retention problem but have serious functional or mental disabilities such as dementia. A device that looks like a condom covers the penis head. Then a tube leads from the condom device to a drainage bag. These catheters are generally more comfortable and carry a lower risk of infection than indwelling catheters. Condom catheters usually need to be changed, but some brands are designed for longer use. This can cause less skin irritation than condom catheters that require daily removal and reapplication of wound. Ostomy and continence nurse can help make these recommendations. Short-term catheters, also known as intermittent catheters. In some cases, you may only need a catheter for a short period of time after surgery until the bladder empties. After the bladder empties, it's necessary to remove the short-term catheter. Healthcare professionals refer to these as an in and out catheter. In a home setting, people are trained to apply the catheter themselves on or with the help of a caregiver. It can be done through the urethra or through a hole created in the lower abdomen for catheterization. Potential complication of urinary catheters. Urinary catheters are the leading cause of healthcare associated urinary tract infections. Therefore, it's important to routinely clean catheters to prevent infections. The symptoms of a UTI may include fever, chills, headache, cloudy urine due to pus, burning of urethra or genital area, leaking of urine out of the catheter, blood in the urine, foul smelling urine, low back pain and achiness. Other complications from using a urinary catheter include allergic reaction to the material used in the catheter such as latex, bladder stones, blood in the urine, injury to the urethra, kidney damage with long-term indwelling catheters, septicemia or infection of the urinary tract.